This is Duncan Turner from the Vagina Doctor podcast. Welcome to the Consult With Me segment where we take a deeper look into our most frequently asked questions. But what do I know? I'm just a vagina doctor. So let's talk about testosterone.
Okay.
Testosterone is a male hormone, but it's produced by both men and women in different amounts.
Okay, but wait, we have to just go into this, why we're talking about testosterone, because testosterone lately, we're getting a lot of women calling saying they want testosterone therapy.
Right.
They just want testosterone.
Yes.
They don't want anything else.
Yes.
So it's trending.
Yes.
All right. Why is it trending?
I'd say it's been there for males for a long time. Men wanting to supplement their own production for physical performance, but also for libido and general feeling of well-being.
But testosterone is thought, when somebody says testosterone, you think male. Okay.
Yeah.
So if you're a female, why suddenly is this testosterone? Why is it something women are like, wait, I want testosterone?
Well, I'd say it started with a company called BioT who promoted the application of testosterone pellets for men and women. And they've been very, very successful in a business plan.
But what is the reason? What is the reason why women think they need testosterone? For what?
Because it can increase libido, increase energy, help sleep.
Okay.
But
so those are the reasons.
Yeah.
Okay.
Mm-hmm. It's a fairly safe medication. It carries some risk. But it's often thought of as a hormone replacement, but it's really not. It's really a supplement. Gradually for men, testosterone levels peak in adolescence and early 20s, and then they decline. And they continue to decline for the rest of a male lifetime. For women, they are within a particular range, about a tenth of the levels of men, but they don't change quite as quickly as men, and they certainly don't change as quickly as estrogen and progesterone at menopause. So what BioT did was enable women to have a significant supplement subcutaneously, placed every 3 or 4 months, which give them the benefits.
So it's a little, basically it's put in their hip.
Well,
but
that's what BioT.
Okay.
That's what BioT were doing, and BioT had a great business plan where they would train physicians to put in the implants. And they would advise the physicians as to what dosing they should use. And they would then supply the pellets to the physician to do that for a certain price. So it was very beneficial for the company. It was because they charged physicians to train them.
Right.
And they required those physicians, I believe, only to use BioT pellets. So that started not just from gynecologists or orthopedic or
trainers were doing it,
and so on. Yeah, and that's how this spread a lot. Mm-hmm. Now, the alternative to use a pellet is to use a cream. For men, there are patches available. I don't believe that there are patches available for women, but there might be.
But there's cream.
But there's a cream. So you don't have to use the pellets. Now, injections are also possible. They're usually weekly injections that men use primarily. Women do sometimes. There's an option there for them to use that. But Most of the time for women, it's pellets or creams, and most of the times for men, it's mainly injections, or it can be implants, and it can be creams, whatever the individual wants.
But like if a woman is presenting and she's not sleeping, she's feeling weak in her workouts, does that come to your mind right away? Like,
Yeah.
oh, you should go on testosterone.
Well, yeah, as long as we can rule out other things that are more important. We're not just going to blankly put somebody on testosterone because they have those symptoms. We're going to look and see what other issues are going on. Is this a thyroid issue? Is it another endocrine issue? Is it a menopausal issue?
So have you always looked at testosterone in women
Yeah.
in labs?
I'm more so now, for sure, but I've used it for years, and it's been beneficial. And a lot of patients who are premenopausal or perimenopausal will do that rather than putting them on any estrogen or progesterone,
Right, they'll just
because
go
they're
on.
not really there right at this point. It's I don't much like using pellets for men because, first of all, men are wimps. Secondly, their skin is thicker, and so it's a somewhat harder implant to put in, and it's 10 times as much in dose than we're giving to women. So there's way more pellets that we need to put in, and men have less fat tissue in which to place it. So it's more of an ordeal, I think. And so I do that for some men, but my preference is teaching them to do an injection themselves at home, or prescribing cream. I don't have any women that I know of, patients injecting themselves, but I have lots of creams.
So for women listening, I mean, because we know what testosterone, I mean, with the male component, but for women listening, if they're struggling with,
it's lives are stressful at the moment in our current society. People are working hard. There's an issue of stress and lack of sleep. And we need to do a full evaluation of the patient to make sure that there isn't some other reason or some reason that we should be treating before giving them testosterone. But testosterone certainly is a good additive, a supplement, and often when we're doing hormone replacement therapy with estrogen and progesterone, we'll use testosterone as well because it sort of completes the picture. And for most of those patients, most of those women, the increase in libido that most people get from good levels of testosterone are very beneficial. And with the men, it improves libido. It improves strength, endurance,
sleep.
And sleep. Yeah, the downside is that, as I said earlier, it's not without risk. There's a little increased risk of blood clots. And we don't want to give it with anybody with an elevated PSA, which is a prostate-specific antigen, which could be a sign of prostate cancer, because that could theoretically stimulate prostate cancer. So if we have patients on testosterone, we have a full metabolic workup initially. We decide what to do with it if everything else is okay, and then we watch things. And the other downside that people get with testosterone, particularly the high levels that men are on, because whereas we might shoot for a level of 100 with women, we're going for about 1,000 with men. And that can cause an increase in the percent of red blood cells per unit volume of blood, increasing the measurements that you would look at in a CBC, a complete blood count, would be hemoglobin and hematocrit, and both of those are elevated, or can be elevated at those higher levels, and that is going to thicken the blood.
So how often do you look at that when you're treating a man with testosterone? How often are you running those labs?
We're doing it at least once a year, but in the beginning, we'll do one before they start, and then we'll do one whenever we're checking the blood level to see if we're getting into the right therapeutic range for them, or the optimal range. We'll do a CBC at that time too. So it'll be done a few times in the first 6 months of them being on testosterone, and then once a year. And we encourage patients to use baby aspirin if their level's getting up. The other side effect of testosterone is you get a conversion of testosterone into estrogen, and this happens in males and females. And the males' estrogen level may rise and can actually give them some mammary gland stimulation. So they have tenderness in the breasts.
Gynecomastia.
And yes, although that may have nothing to do with testosterone.
But we do see those patients.
Yeah.
From the testosterone.
Yep, we do.
Where that develops.
Right.
And most of them didn't get therapy in our office. They've come to us after they've been getting therapy someplace else, and their levels.
You mean testosterone by therapy? You're saying they were getting their testosterone elsewhere? Yeah.
Yeah.
Absolutely. Because that's one of the things that we'll look at.
Yeah.
There is a lot of things that need to be discussed. We do, full consultation with a patient before putting them on testosterone. Follow them closely, and that's the only way to do it.
Thanks for listening. And if you have more questions, please let us know either by email or DM us on the Vagina Doctor podcast.
See you in the next episode. The Vagina Doctor podcast. It all starts here.